Hello, everyone. Good evening, everybody. I am Priyanjali and I represent the Prostate Wellbeing team. We hope you and your family are staying in good health and taking active steps towards overall well-being. Today's session focuses on a sensitive yet extremely important topic: male infertility, and more specifically, the surgical options available for its treatment. Male infertility is often misunderstood and sadly stigmatized. But thanks to advancements in urology and microsurgery, there is hope, and more importantly, there are solutions. To guide us through this vital discussion, we are privileged to be joined as a leading expert, Dr. Krishna Mohan, a renowned urologist, MSDNB andrologist from PSB Hospital, Coimbatore. He is well regarded for his expertise in male reproductive health and surgical precision and compassionate care. His clinical focus includes treating complex urological issues and male infertility through both medical and surgical approaches. We are honored to have him here with us today to share his insights. Welcome, Dr. Krishna Mohan. Thank you so much for joining us up. Over to you with the first topic. The first question is, what is male infertility?
So, male infertility basically has a lot of diseases coming under it. So, we as an andrologist, we specialize in treating men's health issues. So, male infertility is one of the most important diseases that we treat as an andrologist. So, male infertility is basically it is like the male who is not able to the male who maybe after a year of marriage, maybe year of unprotected sex, if he's not able to conceive, the couple is not able to conceive, then we say it as infertility, primary infertility. And
Right.
if it is so, basically infertility can be half 50% due to male and 50% due to
Mhm.
female. So the male part is basically the sperm count and the sperm parameters that decides the male infertility. So this is basically what we treat in male infertility, and it is becoming very common due to the lifestyle changes and various other diseases that are prevalent these days.
Right, right. Now, coming back to the main deal, doctor, what can be the main cause
Yeah.
behind it? With time, we are getting to see this rising issue of infertility. Especially nowadays, we see a lot of men suffering from the same. Can you tell us the reason? What is the reason
Yeah.
behind it?
So basically, male infertility as a disease, if you see, it is basically more of a lifestyle disease. So
Right,
the most of the Indian men have started to become sedentary. They don't exercise. They don't have any physical exertion in order to keep them fit. So once fitness comes down, the lifestyle changes, the infertility has seen a drastic rise. So
right,
as the IT professionals and the software engineers and most of the administrative people in administrative work, most of them are having a sedentary lifestyle. They most of the 90% of the time they are seated, and they don't have any physical activity. Only exceptionally some maybe 10 minutes of walking or maybe half an hour of walking, but that doesn't suffice for the physical activity. So what this is the main causative factor that we see. Rarely it can be due to some physical issues like blockage in the tubes, or it might be due to testicular failure as such. Due to it, that also can be due to any viral infections or some like mumps, or it there can be some other medical factor that is leading on to male infertility. So, but the most common factor that we see is lifestyle changes, and that is what we commonly see these days.
right, right. Now speaking of lifestyle changes, doctor, we are mentioning here about physical workout, particularly focusing on here about physical workout. We tell us, does food habits also include in this? If yes, what kind of food habits are triggering the condition?
Yeah, see, basically, food habits indirectly do cause male infertility. So, food habits, in the sense, India is the capital for diabetes.
Mm-hmm.
So diabetes is basically due to our, it is a metabolic disease, and it is also a
Right.
lifestyle disease. So diet,
Mm-hmm.
Indians are prone for diabetes. So naturally, so when they have junk food, or then they have high caloric intake, and there is very less of physical activity, it leads on to obesity, insulin resistance, leading on to pre-diabetes or diabetes. This can indirectly lead on to male infertility as well. And also, per se, an obesity or a high calorie intake can also lead on to certain hormonal changes. Excess of female hormones and decrease in male hormones can also happen. And also, the diet and the lifestyle, which they have very erratic sleep patterns. So most of these engineers and the software people, they sleep in very erratic times, very short periods. They don't get proper sleep. They are awake in the night. They have night shifts, or mostly other people also. Other most of the jobs these days are filled with stress, and their sleep cycle is severely affected. So what happens if you don't sleep is it affects the hormone balance as well. So that also can lead on to infertility as well.
Right, right. Now, moving on to diagnosing the condition. I mean, if we
Yeah,
talk about the current situation or the situation previously, nowadays people are well aware of the condition.
yeah.
People have started somehow accepting that apart from women, men can also suffer from the same. Man can also be the reason behind infertility.
Definitely.
So, because of technology or because
Yeah.
of information being circulated so easily through internet, people are becoming aware. So now, the main thing behind infertility, I think, is acceptance. People do not want to accept it. I know a lot of men,
Mm,
they
yeah.
face challenge in accepting the fact. so, what is the early stage? What does the early stage look like? How does one know in the early stage that he is having such kind of issue and this is the time he should visit a urologist? What are the early symptoms we can say?
See. Yeah, so basically, most common time they come is around 1 to 2 years after marriage. If they don't conceive, the couple comes to us with male infertility. And also, see, now as the awareness increases, more men are aware about the problems and they do come to us early. But in maybe in the rural side, maybe they have some taboo related to male infertility and they don't come out
Mm-hmm.
as much. So basically, most of them are now these days are in the cities. They are educated. They are aware of whatever can happen. They are very aware about male infertility as well. So we as an andrologist do promote as well premarital checkups before they get married. They can all checked. So basically, how do we tell them that if they have any history of family history of infertility, also they can come for a premarital checkup and get tested. So basically, how we test them is we do just first we suggest them a semen analysis. So we check the sperm count, the parameters like motility, progressive motility, and as well as morphology of the sperm. So we check whether they have any low counts or low motility or low morphology is bad. So we accordingly we diagnose them as male infertility. So male infertility, basically the initial test that will be required to diagnose as male infertility would be basically a semen analysis. If we find something is wrong with the semen analysis, then we would further investigate with other tests like scans and blood tests and other hormonal workup, everything. Yeah.
Right. So what we think is nowadays, because situations like this have arisen with time. So every single people um, before getting married or before your commitment to somebody, everybody should go through a checkup. That's what we always suggest our patients, no matter what kind of condition you are suffering from. Monitoring your health has become very, very important nowadays. A routine checkup entirely throughout your body has become very important. Without feeling shy, without being ashamed of any fact, of any condition you have in your body, please visit an expert and get yourself checked first and foremost. Now, coming back to the treatments, doctor, which are available, let's make people aware about the treatments as well. Are there any non surgical alternatives? Because, of course, we are normally scared of surgery. Whenever we tell our patients that you have to go through surgery, the patients, they take a step back because they do not want to opt for surgery, especially when we are talking about infertility today. Uh, let's first know
Yeah.
about the non-surgical options, if if there are anything available for them. Which one should the men try first? The non-surgical option, or they should go for a surgery without any hassle or without any tension?
See, basically, the surgical, non-surgical depends upon the severity of the male infertility, the
Right,
semen
right.
test counts, everything. So, if they have a medium to a mild decrease in the sperm count with a mild alteration in the motility and morphology, maybe we will start with non-surgical only. We might not directly suggest the surgical option. So for these mild and moderate patients, we do ask them to take some nutritional supplements that
Hmm.
will promote the sperm production as well as improve the motility and the morphology. So these patients, about 60% of the patient do improve with these nutritional supplements alone. So the patients who do not improve with these, still the count is low, motilities or morphology is being bad, then we suggest for other options like surgical options. So basically, the first step would be in mild to moderate infertility would be generally giving them supplements, nutrition supplements to improve their sperm production.
Right, right. So coming back to the surgical option now, doctor, when do we normally recommend surgeries to the patients who are suffering from male infertility?
So, so first, the indication would be a very low sperm count. So very low, it is likely nearing undetectable levels, or absent, completely zero sperm in the semen test. So in these patients, we suggest surgical options. So they are divided into obstructive, so some block in the passage, or non-obstructive, basically testicular failure. So in obstructive, if there is a block in the tube carrying the sperm, then we surgically undo the block and then connect the tubes back together so that they can the sperm freely flows and the sperm count improves. But in the non-obstructive, when there is no block, but basically the testis is not producing anything.
I'm sorry to interrupt, doctor, but you are not audible. We are not able to hear you properly.
Yeah. So are you able to hear me now? Is it audible? Am I audible now?
Um, I believe there is some glitch with the mic, doctor. If you could please check once because you're not audible to us properly.
Am I audible now? Am I audible now? Hello? 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 Am I audible now? I'm able to hear you. Are you able to hear me?
We are still not able to hear you, doctor. Am I audible to you?
Yeah, you're audible. Your voice is little crackly.
I believe there is a slight network glitch. So we'll request you to please rejoin after leaving the studio once. I believe that
Yeah,
can fix
one
the
minute.
condition.
One minute.
Meanwhile,
One minute.
I can help the viewers stay connected with us. We'll request you to once leave the studio and rejoin us once again, please. Thank you so much. Well, everybody, people who have already joined us, people who are still joining us, we will request you all to please be connected with us as we'll have Dr. once again joining us today. Today's topic is male infertility. We'll request all the people who are watching us, all the viewers who are watching us to come up with their questions because you know that we attend all your questions towards the end of the discussion. Well, we are talking about a very, very important issue today, and an issue which almost everybody is worried about, and everybody, almost every second person, is suffering with. Today, we will know about what are the options available to treat the condition. Also, we will know if it is treatable completely or not. We know a lot of people who are worried, thinking the same, if the condition will be treated, can be treated completely or not. So we will be targeting all those questions. Also, we are waiting for your questions.
Hello.
People, please come up with your questions. I believe doctor has already joined us. Doctor, can you please
Yeah, you can hear
say
me.
what?
Am I audible?
I
Hello.
believe there is still a network glitch.
Am I audible now? Hello. Hello.
Sir, we will request you to please disconnect the Bluetooth if it's connected.
Sorry. Hello. Hello.
So,
Hello.
viewers, please stay connected with us. We are still trying to get Doctor with us, and as we know about the topic which we are discussing about today, as I was saying, please come up with your questions. Uh, any people who are still worried about the issue and you are wondering what to do next, make sure you write down to us in the comment section with your issues, and we will make sure we attend those questions today. We are in discussion with
Hello.
Dr.
Am I
Krishna
audible
Mohan, who is
now?
here from Coimbatore today.
Hello. Hello. Hello.
Well, ladies and gentlemen, we are still waiting for your questions. Uh, like every time, today also we have come up with a new topic, a burning agenda, a burning topic which people are suffering from at today's time, and they are extremely worried about. Again, saying it all to all the people who are suffering from such condition. Please, please make sure you are getting yourself checked. You are
Hello.
monitoring your health. Yes, doctor.
Hello. Yeah,
Yes,
yeah,
you're
yeah.
audible to us.
So
Yes,
sorry,
we can hear you.
something was
No,
some
it's absolutely
connection
fine, doctor.
issues. Yeah,
It's
yeah,
it's
yeah.
absolutely fine. So we will go with the previous question once again, doctor. Uh, the surgical options which are available currently.
Yeah, so we were talking about the non-obstructive and the obstructive. So if there is some block in the tubes carrying the semen, so that can lead on to a low or an absent sperm count. So sperm in the semen. So at that time, what we do is surgically remove the block by a minor surgery, and then reconnect the tubes again so that the semen can freely pass through. So this is one of the surgical treatments. So another one is the non-obstructive, and the testis itself is not producing sperm. So in these cases, what we do is we do two procedures. One is testicular sperm aspiration. We directly aspirate the sperm. Aspirate meaning take the sperm directly from the testis using a small needle directly into put it into the testis and aspirate it. This is through a local anesthetic procedure. This is something procedure. And another procedure, if we don't get any sperm by aspirating, then we go for an open procedure, open the test using microscopy. We identify the tubes that have semen, which have the sperm, and then take it out and then use it for the IVF.
Right, right. Doctor, we have also heard about varicocele. Could you please explain what is that?
Sorry, what I didn't get
We
please.
have also heard about varicocele, doctor. Could you please explain what is that and how does correcting it will improve male infertility?
Varicocele is a very common issue that we see in many males, but very rarely it can cause full-blown infertility. It can cause subfertility. And this varicocele is nothing but the dilatation or swelling of the venous blood vessels which take in the deoxygenated blood from the testis. So when these veins get swelled up, it is called varicocele. This can lead on to stagnation of blood in the which carries the bad blood away from the testis, which can cause stagnation and decrease in the sperm production. So if it is very large, if the swelling is very large, we can clinically see it, or if ultrasound says it is anything above grade 3, the varicocele, then we would operate on this patient and then using microscopes and then we do a microscopic varicocele repair in order to improve the blood circulation to the testis and in turn improve the fertility.
Okay, everybody, I believe we have lost the connection once again. We are trying to get it sorted. In the meanwhile, people, please stay connected with us. As said, please come up with your questions. We will make sure that we attend all the questions towards the end of today's session. Today, we are talking about male infertility, a burning topic, a burning issue in the current situation,
Hello,
especially, yes, yes, doctor.
is it audible?
Uh, I believe there is still a glitch in the voice because we are not able to hear you properly. Well, as I was saying, uh, as a doctor has earlier mentioned that due to the work stress, due to not focusing on our health, due to lack of physical work exercise, due to irregular sleep pattern, due to unhealthy food or dietary habits, this is one thing which we are getting to see very commonly in today's time. So all the people who are still wondering कि पिज्जा बर्गर खा के आप ऐसे ही जिंदगी चला जाएगा आपका and there will be no issue. Yes, we have Doctor once again with us. Doctor,
So the varicocele, so as I was telling you, it is the arterial swelling of the blood, the veins, which take in the bad blood away from the testis. So when the swelling is too large, when the swelling is too large, it is more than grade 3 in the scan, then we go in and operate using a microscope. We do a microscopic varicocele repair. So where we tie the blood vessels which are swollen so that we improve the blood supply to the testis, in turn improve the sperm production from the testis.
right.
Hope that is
Uh,
clear.
quickly, yes, yes. Right. Quickly, doctor, will dive into the next question. Talking about the surgeries once again, doctor. Are these surgeries painful or risky? And what is the typical recovery time which we can see? How normally does people get recovered? What is the usual time?
Yeah. See, all All these male infertility surgeries are very not a major procedure. They do have minor complication like infection or bleeding, like any other surgery. We do it
Mm-hmm.
under anesthesia, so they don't have any pain. So they can be comfortable. Recovery is very fast. Maybe within 1 or 2 days, they can be back to all their work and everything. There's no specific or worrisome complications from these male infertility surgeries.
Right. But does doctor treating a patient in the earlier case, in the earlier stage, is it more easier than a patient who has prolonged the condition?
Yeah, definitely. The earlier stage is far better than treating at a very severe or absent sperm in the semen. So always when they
Right.
come early, it is easier to treat and they can also have good results when we treat early.
Right, right. Again, coming back to the same topic, everybody, people who are wondering, कि doctor के पास जाए कि नहीं, what will people think, what will the society think, what will my family think, everything comes, everything becomes secondary. First of all, it's your
Mhm.
health. Make sure you are
Yeah.
not dodging the topic. Make sure you are taking it seriously. Make sure you are visiting an expert at the earliest stage when you understand that this is something that you are facing. Please accept the truth and visit the nearest expert. Coming back to the next topic, doctor. Um,
Yeah.
how successful are these surgeries? A lot of people might be wondering that we can go for a surgical process, but is is it possible that the person is treated completely and he does not have to visit the doctor once again, or he there is what is the chances of recurrence in this case?
No, the thing is basically male infertility is like a one-time thing. So when you do the surgery, we
Mhm.
get the sperm and we do IVF and the couple gets they conceive. So the thing is, there's no recurrence or anything. So basically, a male infertility, if it occurs, patient will have infertility. Using maybe if we treat a obstructive block, then we treat the block and it is removed, then they can be lifelong they are cured. But if the testis is not producing any sperm, then the lifelong they would be not having any sperm in the semen. But the thing is, what we do when we do these surgeries, take the sperm and do IVF, they would be having, they will be getting pregnant and they will have children. So that is the main outcome of these male infertility surgery. So if you take it in the aspect of success rate of these surgeries, they have good, very good success rates. And depending upon the severity, so that is why we say come early, get treated early, outcomes are far better. And the outcomes of this male infertility surgeries, the only outcome is successful pregnancy. So so once the couple conceives, that is the success of this surgery.
Right. Now, when we are talking about surgery, doctor, another thing which comes to our mind and which we are usually worried about is the cost which is involved. Can you please
Yeah.
also elaborate about the same?
So cost varies according to different surgical procedures and different psych. See if they want to go to IVF or they are doing IUI. So different artificial reproductive techniques are there. So they
Right.
can range from various costs, right? From say as low as 50,000 to maybe very costly, double or triple that amount like that. So it depends upon each and every couple what problems they have, whether the wife also has any issues, infertility issues. So everything combined, the cost. So cost varies very depending upon the issues. So, but basically in India, we have the most cost-effective treatments available in India. So every patient can have proper good treatment at a very cost-effective rates in India. So, basically, so we also tailor the patient's treatment according to their severity and also what the patient can afford. So what the patient can afford, if what they are willing to spend on. So because fertility can The costly treatments are there. We do explain to the patient the success rate, how successful the various treatments are, and the couple can decide what they want to undergo.
Right. Doctor, also tell us, does Mediclaim or health insurances cover this procedure as well?
See, basically, a lot of insurances, when it comes to infertility, they do not cover unless you have a clause when you are taking an insurance. You have to specifically tell them that we also want cover for infertility. So it is like cancer also. So previously, the incidence of cancer was very low. Now it is increasing the incidence. So naturally, so patients, so whenever you take insurance, it is very essential for us to take, which includes cancer, infertility, everything as a whole something. So most insurances now are making an effort to include infertility, but some insurances might not cover the infertility treatment. So that is the problem. So if you have, when you're taking the insurance itself, if you make it a point to include all these things, then you might benefit when you have any issues.
Right, right. Doctor, also, do men need to make any lifestyle changes before or after the surgery to improve the recovery outcome? And what are these changes?
Sorry, what is that? I didn't get you. Sorry.
Sorry, doctor, what I was asking is, are there any lifestyle changes before the surgery or after the surgery which is required to, improve the recovery outcome, and what are these changes?
The recovery outcome basically healthy diet, proper wound care, and then cleanliness. That is what is required. It is like any other surgery. So, in order to promote healing, proper healing, we would suggest them to have a good, healthy diet, rich in vitamins and green leafy vegetables, fruits, so that, and also vitamin C, so that the wound heals better. And also proper cleanliness around the surgical area is always essential in any surgery. So all the tip, like a normal surgery, they can also for this also it's the same. There's nothing special for these surgeries.
Right. Doctor, we had a very insightful discussion with you today about the topic. Before we take a leave, doctor, any take home message for our viewers who has watched us so far?
Yeah. So what take single take home messages? Male infertility has become very common. So it is imperative for everyone to get tested early, diagnosed early, so that men need not worry that there might be some social stigma associated with it. Need not worry because people are now become more aware. They can confidently come to get diagnosed with an andrologist, get treated with an andrologist, and then if they get treated early, because male infertility is a disease per se. So it is a disease. So if you get treated early, the outcomes are always much far better, and they can be rest assured that the male infertility is curable if it is diagnosed early.
Right. Well, that was the expert advice for today, and that was Dr. Krishna Mohan for us. Thank you so much, Doctor, for sharing such honest and informative and empowering insights. Your guidance today has not only helped demystify surgical options for male infertility, but also offered hope and clarity for many viewers. To everyone watching, infertility is a medical condition, not a personal failure. And with the right diagnosis and expert care, solutions are possible. Stay connected with us on Facebook page, Prostate Wellbeing, and follow us on YouTube, Instagram, and Twitter for such expert sessions and health tips. Stay informed and stay proactive. And take charge of your health. Have a wonderful day, everybody. Stay safe and stay healthy.
Yeah. Bye.